Right there? Okay. Well, good. Well, let's get going. And I'd like to, first of all, welcome everybody to our webinar on PTS and PTSS. It's going to be hopefully an informative day. I have an opportunity to be with a gentleman named Joshua Littrell. Joshua is the founder of the Veterans for Cannabis organization. I have to tell you that we take this subject very seriously. It's something that for a lot of people and for a lot of individuals, it's something that dominates their life, and it's something that's getting in the way of their living the life the way they want to, get their life back. PTSS is not something just for veterans, and I'm going to let Joshua talk a little bit about that. There are people that can have auto accidents. You can have a childhood issue. There's a lot of people today that, because of the current COVID situation, are feeling the anxiety and the stress that's there. So we're going to talk about the subject matter. Joshua has a lot of experience at it, and then we'll hopefully give you some information about what it is and how to manage it and some resources to be able to help you. Joshua, I'm going to introduce you very quickly as the founder of Veterans for Cannabis. And why don't you tell me a little bit about yourself and your organization?
Yeah, absolutely, Mark. And thanks so much for having me here. And thanks everybody for tuning in too. This is something that's really near and dear to my heart, obviously. And Mark, you've done a really great job of, allowing a platform and lifting up the issues that face the veteran community. And just like you alluded to earlier, this is not something that hits only veterans. And the first time I spoke in front of a Senate and House committee, I actually said that, hey, veterans aren't the only ones that suffer from post-traumatic stress, because it's brought on by a stressor situation. I hate to use the word disorder. Everybody calls it PTSD, and I severely dislike that, and many in the veteran community dislike that as well, because it's technically a post-traumatic stressor. That's really what this is about. It was brought on by a stressful situation that is oftentimes either exacerbated by certain situations, or it puts you in situations where you don't feel comfortable, you can't have that anxiety and all that good stuff. So thanks so much for having me tonight. I'm Joshua Littrell. I'm founder and CEO of Veterans for Cannabis. I'm a combat veteran of the United States Air Force. It's 6 years, a couple tours overseas. I served in Operation Iraqi Freedom and Operation Enduring Freedom. And, it's something that I've been managing for a couple decades.
You've testified in front of many committees, Georgia, U.S. Senates. You've been an advocate. You make your own product. You make Veterans for Cannabis CBD oil. And you did that to be able to address the issues for the veterans. Is that correct?
That's correct. And that's all it really came down to, is the VA unfortunately just throws meds at us hand over fist. And we had to find a safe alternative to help us reduce that opioid dependency and pharmaceutical dependency that the VA has basically forced on us. And that's where cannabis comes into the forefront as a really great treatment option and alternative. All we say is we're fighting for the choice. All we want is to be able to have the choice. I'm not saying it's for everybody. I'm not saying we got to have it no matter what. Just give us the choice to choose cannabis over benzos or opiates, or combination of both if nothing works.
I think it's important that what we're trying to do here is to have a group provide safe, supportive, judgment-free area where we can discuss this with respect to medical cannabis. We're not trying to make any judgments. We're trying to present the facts. And then also we want to be able to have that whatever you're doing, naturally consult your physician, because they're an important part in this whole program. We're all in this together, so I think it's something that hopefully as advocates, as patients, as students, researchers, we can take a look at. First of all, let's start with the definition of what it is. Joshua, you want to take this one?
Yeah, I'd love to, Mark. As I mentioned earlier, the PTSD is what everybody's commonly, they understand it as. And PTS, or post-traumatic stress, is a common, normal, and often adaptive response to experiencing a traumatic or stressful event. And that's something that can happen to anybody. As you mentioned earlier, something that I've seen a lot personally in my own life and in my military career is military sexual trauma. But military sexual trauma doesn't only happen in the military, obviously. So you've got kids that may have had sexual trauma when they were younger. Men and women both suffer from sexual trauma. So that's something that a lot of times people often forget, that PTS can actually be there and exacerbated from a sexual trauma itself too. So it comes from so many different areas and has a lot of different things that come along with it, where it's the heart racing, hand shaking, sweating, all these crazy things that happen to you. You can seize up. And then PTSS, which is post-traumatic stress syndrome, basically. It's clinically diagnosed. And that's really the difference in it is, one has been diagnosed by a physician and one basically has not yet. The symptoms are very similar. Oftentimes with PTSS, these symptoms are even more, they're higher. They're a heightened awareness. You have night terrors. I actually get night terrors myself, so I know that feeling. I've woken up in the middle of a night terror, sweating and crying and in enormous mental pain, and just could not get out of that situation. Even though I was awake, I was having a night terror. That's crazy. So I've got buddies that have flashbacks when they're standing at work. There's a constant reminder always there. And then there's a great side effect to cannabis that very few people actually talk about in a positive way, and that's that short-term memory loss, Marc, that we've talked about. Well, one of the great things about short-term memory loss is it allows you to stop constantly thinking about that issue, that stressor that causes that post-traumatic stress that you may be suffering from. So a lot of different things come along with it. The duration and intensity is different for each person. And it's really about finding that proper way to manage it for yourself personally.
And I think it's important to understand, we understand more about this than we ever have before. And I say that because my father was a World War II veteran. He spent 4 years in the South Pacific. He went through a lot of traumatic experiences. Out of 52 men in his Marine battalion, only he and another man lived through the war. And I say that because my dad had PTS. He was never diagnosed with the condition. But in my life, up until the age of 14, I lived in San Leandro, California, which is near Oakland. And we either were there where my dad had his business, but I was a roofer, or we were at our mountain cabin that was 125 miles away. But we never saw anything else. My dad was only comfortable where he grew up. And the reason he was comfortable in the mountain cabin was because after the war, he went up to that cabin and rebuilt part of it for a year to basically kind of get over what he was going through. But we never went to Monterey. We went one place or the other. That was it.
Well, and Marc, I would say that your father actually probably went to that place and rebuilt himself in a way too. And that's something that a lot of times, that's what we'll be talking about through this process, is that personal rebuilding that you may be going through or have to do.
Sure. Let's talk a little bit about the history of it. It's important to point out this isn't something that's new. I think it's new because we're talking a lot about it, and we're actually trying to do something about it. But you look at in the 16th century, there was an Indian preparation that was discovered to help people to be able to help their anxiety and to sleep. In the 9th century, there were physicians that were packing noses to be able to help with migraines and things. In the Civil War, cannabis was being used to reduce opioid use and to treat pain. In World War I and World War II, it was called battle fatigue or shell shock. Mm-hmm. We hear a lot about it. A lot of movies talk about that. They talk about the condition, but they never talk about the situation to relieve it or to treat it. That's and right. Naturally, of course, when Vietnam came along, there was a lot of the soldiers which were smoking cannabis. But this is when PTSD or PTS really got recognized, I think, for the first time across the nation. Let me put it to you that way.
Absolutely.
So, it's not something that's brand new. It's something that came about. When we talk about how to treat it, I think it's important to understand that we have in our bodies an endocannabinoid system that parallels our nervous system. And the endocannabinoid system is interesting in that what it does is it helps your body regulate your memory, your appetite, inflammation. It controls your mood. It's basically the system in your body that helps your body regulate itself. And it's comprised of receptors, both CB1 and CB2 receptors. And what's interesting is the CB1 receptors are primarily found in the brain and the central nervous system. And the CB2 receptors are primarily found in the organs. And these receptors are something that your body uses to heal itself. And how it does that is your brain produces endocannabinoids. Those endocannabinoids are produced through endocannabinoids. And it's interesting how that when your brain says, I have a problem, what it does, it needs. But if you're not producing enough of it, you can actually supplement with plant-derived endocannabinoids. And that's where CBD, that's for buds, tinctures, extracts, and things like that come into play. And actually, there's a synthetic product that's out there. It's called Marinol. Marinol, it's pure THC. It has some harsh side effects, but I just want people to know it is out there. I don't recommend it, but it's something that people definitely have used in the past. But this is what controls your appetite, your pain, your pleasure, your sensation, your immune system. This is how your body works, which is very, very fascinating. And then also the question is, where do you get these? And I'm going to let you talk about this a little bit, Joshua. So there's a couple of different plants that produce it. One of them is hemp, right?
Absolutely, yeah, and you know, it's a lot of things that I tell people oftentimes is cannabis is cannabis is cannabis. Any way that you look at it, we're going to give a really great understanding of what the difference is. And I use an analogy I think that most people can understand. A bulldog and a Shih Tzu are both dogs. Any way you look at it, they're just different breeds of dogs. Well, hemp and medical cannabis are exactly the same plant, but they're just different breeds of that plant. So the hemp plant itself is typically used for fibers. It's taller, it's longer. Most of the time, they're going to use it for seed production. You have really thick roots. It's a tall, lanky plant. And then your medical marijuana, if you will, is a shorter, stockier plant that you're only going to utilize the females in, that has the big buds that you can see right in the middle of the section there with the trichomes on it. Those are those white, clear-looking crystal ball things that are on the side as listed as trichomes, and that's the difference really in the two of them. Is one is tall, lanky, used for fiber basically, and CBD production now, which a lot of people mistake is we're actually growing a shorter, stout female plant for our hemp CBD production that looks almost identical to medical cannabis now. The only way to tell the difference is to do a chemical analysis of it and determine what cannabinoids are present in those two.
Well, I think it's also important to understand that the hemp plant, which is really it's more like a tree, and it's used a lot for building materials, for textiles, for paper, and those kinds of things. And when you look at cannabis, it's really like it's a bush, it's a weed. That's why it's called weed. It's interesting that typically in a bottle of CBD oil, a quality bottle of CBD oil, you need somewhere between 6 to 8 hemp plants in order to produce enough oil for that bottle. Where with cannabis, you only have to produce about a half. You don't need about a half of the quote unquote bush to be able to produce the same bottle. So high quality hemp is basically it has a cost to it, and I think that's important to understand. Do you want to talk about broad versus full spectrum?
Absolutely, because this is something that I get all the time from a question analysis standpoint is people, well, is it full spectrum? Is it broad spectrum? Is it CBD only and all this good stuff? And the issue that, and this is for you all listening and paying attention during this presentation, the issue that we all face now is the terminology is not uniform across the board. So my broad spectrum may be different than your broad spectrum. But let's give you guys some real black and white definitions of what broad spectrum and full spectrum are. And when we're talking about this, we're mostly talking about the hemp CBD based products that you'll be looking at. But this goes full in line with medical cannabis as well. Is it a full spectrum product that's on the medical cannabis side that maybe has everything in it? And same thing on the industrial hemp CBD side. Broad spectrum has had the THC removed from it. So it still has all the great things in it, the terpenes, cannabinoids, the flavonoids, and it does not have the THC, the psychoactive side of that plant. Full spectrum CBD products do have THC in it, although it doesn't cross the legal threshold, which is 0.3% THC, 0.3% THC by dry weight to classify as industrial hemp. So full spectrum products, in my opinion, are a better product than broad spectrum. However, broad spectrum absolutely has its uses because in our veteran community specifically, we have tons of veterans that are working GS jobs, federal employees, state jobs that they cannot have THC in their system. So guess what they need? They need a broad spectrum product. They need a broad spectrum product because broad spectrum doesn't have THC in it, but it's still got all the great things in it in addition to the CBD, like the terpenes, cannabinoids, and flavonoids that I mentioned earlier. You can get a CBD only product, but that's like using toothpaste with only one little constituent of toothpaste in it. So you want a broad spectrum product with no THC in it. If you're going to use a broad spectrum product, then you can't have any THC in your system. So great slide, Mark, and I love to be able to define that for people.
Yeah, and I think it's important to understand that when you have THC and the CBD together, it's like 1 and 1 is 3. You're getting a lot more. It's called the entourage effect. You're getting a lot more, let's just say, medical benefits from it than with broad spectrum. But again,
Absolutely.
broad spectrum is good because if you're being worried about getting tested for THC, it helps you be able to pass those tests.
Yeah, and Mark, let me just touch on that point a little bit further. On the full spectrum products, people hear THC and they flip out, right? They think, oh, I'm going to get high. Guys, we're talking about 0.3% THC, which is less than, most of the time, it's less than a milligram per milliliter in these bottles that are being sold. Even 0.3 is only 3 milligrams of THC in it per milliliter. So you're not going to get high unless you drink a whole bottle, and then you're probably going to have more bowel issues than you are going to have psychoactive issues. So just know when we say it has THC in it up to that legal limit, we're still talking about a product that is not going to make you high.
This is important, and when you go to purchase the product, purchase from a reputable vendor who can talk you through this if you have any questions.
Absolutely.
I'd like to play this video, and I think it's important to understand how cannabis works.
Reducing the activity of tumor necrosis factor 1 alpha, we also reduce the activity of amino hydrolase. This is a byproduct of fatty acid metabolism that can actually have a negative effect on overall endocannabinoid activity. Basically, all this means is by reducing the cytokine activity of these two things, we are allowing endocannabinoids to do their job better, and we are allowing anandamide to come into fruition, and we create more of it. And if you don't know anandamide, it is very much so responsible for creating bliss within the body, reducing inflammation in the joints, but also reducing inflammation in the brain. It truly is known as the bliss product of the body, because that's the sensation that best describes what anandamide does. But in knowing that, we have to wonder, well, how exactly does it do that? Well, it's because it holds the key to be able to turn off nuclear factor kappa B, or at least greatly reduce it. Nuclear factor kappa B is one of the most widely researched inflammatory substances within the body. It is basically the master control switch when it comes down to inflammation. If we can reduce nuclear factor kappa B, we can reduce the actual DNA result of inflammation within our body. You see, if nuclear factor kappa B is always elevated, it can change our DNA to be used to having high amounts of inflammation. So really, anandamide is one of the keys to actually getting rid of this problem where our bodies are getting so accustomed to inflammation that we're just adapting to become these inflamed creatures. So it truly is allowing our body to turn off that master switch when it comes down to inflammation. And mind you, it is doing this all without ever activating CBD1 or CBD2 receptors within the body. I will say that again. It does not affect CBD1 or CBD2 receptors in the body. A lot of marketing collateral out there will tell you that CBD oil does directly affect one of the CBD receptors. Not the case at all. All CBD oils do the same thing. They naturally increase the production of our pre-existing endocannabinoids.
Your body's producing its own medicine. What it's doing is it's then sending those signals to the place in your body that is addressing it. Now, there's been a lot of studies. There's a question that came out about studies in PTSD and PTSS. There are a number of studies that have been done. 2010, I'm not going to go through each of the studies, but you might want to mention a couple of them, like the 2009 study, Joshua.
Yeah, absolutely. So, and one of the things to keep in mind is most of these studies, if they were done, they were not done in the United States. And if they were done in the United States, they were done under very not the best of conditions. What I mean by that is there's only one grow operation in the United States at the Mississippi grow that gets federally medical cannabis. So you can only get your medical cannabis for any studies in the United States from one grow operation. That back then in 2009, it was only one strain, and they didn't have a lot of differences in cannabinoids, didn't have a lot of differences in terpenes. So the evidence even showed then that 72% of the patients noticed a reduction in nightmares and flashbacks. That's a crazy amount at 72%, plus the ability to fall and stay asleep. Now, keep in mind, back in 2009, like I said earlier, that was one strain of cannabis. Now we're in this wonderful cornucopia of cannabis flavor, if you will, but great genetics that are being produced right now around the country. So Dr. Sue Sicily is a friend of mine, and she just completed a study last year, but it only had about 60 or 70 veterans in that study to really focus on PTS management with cannabis itself. So we've done a lot of studies, but we still got a long ways to go to completely understand this. Right now, we're just touching and scratching the surface.
Yeah, and I think a lot of veterans, and not people in general, not just veterans, but a lot of people with the syndrome use it to be able to sleep. I mean,
Absolutely.
Sleep is important for your body, and being able to calm yourself down, to help you get into a place where you can relax, I think does an awful lot to help you get your life back.
It does. I think most physicians would actually probably say that sleep is the number one benefit to getting your life back in order. When you can allow your body to rest and reset, sleep does that. And if you don't have sleep and rest, you're not able to recuperate and get better.
Right. And one of the other studies that came out from NYU is that what happened was a lot of researchers found out that the PTSS is being directly affected by the endocannabinoid deficiencies. In other words, if you have that deficiency, that's what's causing a lot of the problems. Hence why a lot of the people that have used it, both veterans and non-veterans who've used CBD oil or medical cannabis, have actually found out that this is very beneficial for them. We talked about CBD and we talked about THC. I just want to go over it real quickly and let people know that there's the CBD side of it, which is the non-psychoactive portion of it. It's also found in hemp. And then there's THC, which is the psychoactive part of cannabis. And that actually helps with a lot of the conditions, especially conditions that have to do with injuries, head injuries, and things like that.
I want to first preface this by saying, right now, it doesn't matter sativa or indica at all. What really matters is what is the cannabinoid content or profile of the medicine or hemp-based CBD product that you're using. So Full Spectrum has different cannabinoids in it. CBD, CBG, CBN, THC, all these different terpenes, all the different flavonoids in it. So sativa and indica used to be the old way of doing business. Sativa was tall in stature, narrow leaves, longer flowering cycles. Indica was that shorter plant, broad leaves, shorter flowering cycles. But right now, it doesn't matter sativa or indica at all because very, very few companies are actually producing products that way. It's really about what is the cannabinoid profile, what's the terpene profile, and what does your body look like? How does your body react to it? What is your own biology? And then you have to determine how to dose yourself and how to properly consume that medicine, whether it's edible, whether it's vaping, whether it's topical, whether it's transdermal or under the tongue, so sublingually. It's all about you and doing their own personal research. That's really, if you take anything away from that slide at all, don't worry about sativa and indica. Worry about what is the cannabinoid content of your medicine and what is the terpene content of your medicine. Because in my opinion, and lots of the opinions that are happening in the medical community right now, terpenes are having a lot more to do with beneficial therapies than most of the cannabinoids are. So, and terpenes really, guys and girls, the only thing terpenes are just essential oils. You've seen that essential oils have been used for decades now. Now you're talking about what is the terpene content of your medicine? That's a big question and a big answer you need to know.
Yeah, but terpenes also trigger certain cannabinoids that help you with your particular medical condition. One of the questions I had when I first got my recommendation from a medical marijuana doctor here in Florida was, I went into the dispensary and they looked at my recommendation and they said, here's the products that you should take. And I was always confused, out of the 100 of products that I saw on the shelves, how did they know it was those that worked? And what I did on the second visit was I asked them that question, how do you know? And they said, based on what your condition is, based on your recommendation, we match that against a terpene profile. And that terpene profile tells us what product would be best for you to be able to address that situation. They're very similar to aromatherapy, but it triggers in your body, it triggers various responses. Let me give you an example. You want to talk about this one, about limonene, about how it helps with anxiety and depression?
Yeah, so limonene, it's got a lot of potential medical value. And when we're actually talking about this, all these terpenes that you're going to see in the following slides, there's a lot of scientific data that backs up everything that we're saying. So I've always been that kind of person that's don't just take my word for it. Go do your research. I think if you get anything from Marc and I tonight, it's that, hey, we're just letting you know what's out there. go find out what works better for you. So limonene is a great one for the treatment of anxiety, depression, inflammation, pain, and cancer. Well, when you talk about PTS treatment, a lot of PTS is anxiety-induced PTS, so limonene is a great terpene to utilize for that. It helps you improve your mood and eliminate or reduce stress.
Yeah, and I think one of the things that you should not take if you try to take PTS is pinene, right?
Right.
I mean, what pinene does
has
is
a lot of different effects that it's beneficial for, obviously, asthma, pain, ulcers, anxiety, and cancer. But when we really talk about which terpenes work better, limonene would typically be better for most people that are trying to manage that truly high anxiety. But it's also one of those things where we've got an extra and say, maybe it's not for you. But guess what? It may be, because maybe your chronic PTS symptoms are exacerbated by pain. Well, pinene actually helps reduce pain. So that's what we're trying to say, is find out what works better for you. You may have the PTS, or your issues may cause you to be lethargic and not want to do anything. Pinene is great for alertness and memory retention, where most of the time, we mentioned earlier, Mark, we want to get rid of those memories from a PTS standpoint.
Right.
Pinene helps you retain memories.
Right. So in other words, you're making the situation worse. I think a lot of people have said, well, I'll just go smoke a joint and everything will be okay. And I guess that's one way of approaching it. But if you don't have the right terpene profiles in the product that you're using, you may be actually may be stepping back and not stepping forward as far as being able to help yourself.
Yeah, and Mark, on top of that too, a lot of people say, I've got the same guy. We've been using that for decades now. It works for me. That's great, because I've seen it personally that 3 out of 4 times you get blue dream. 3 out of 4 times it works well. It helps you relieve your symptoms and anxiety. But there's one time out of that it looked like blue dream, smelled like blue dream, but it just wasn't blue dream. How do you know it's blue dream? You don't have any chemical analysis. You got no lab analysis behind it. You don't know what's in it. You don't know what terpenes are in it. So really, it's about making sure you're getting it from a quality, reputable place that has lab analysis to go along with those products. Yeah, linalool is one of my favorite ones personally, because I like lavender. I love the color purple too, obviously red, but it really helps, with anxiety, depression, insomnia, and pain, inflammation, and neurodegeneration. Well, when you think about linalool and you think about PTS, man, almost all 6 of those potential medical values of linalool are consistent with, I would say, 85 to 90% of PTS patients. So you've got anxiety, you got depression, insomnia, pain, inflammation, neurodegeneration. Linalool is a really great one that may be an option for you from a terpene standpoint.
Yeah, and again, when you go into a medical cannabis dispensary, you can actually talk to the people at the dispensary, and they'll tell you about the terpene profiles that are out there. And then the last one I thought it would be good to bring up is myrcene.
Yeah, and myrcene is beautiful from an aromatic standpoint. For me personally, I like fruits. It's present in mangoes, lemongrass, thyme, and hops. It's got some really great, sedating benefits. And what I mean is, it helps you relax. So if your PTS is that really high anxiety, on the edge all the time, myrcene is really good at helping you relieve that, tamp it down a little bit. It helps you relax. So it's a great one to look at. So maybe myrcene and linalool would be a good combination for you if you're trying to relieve your PTS and you're really on edge all the time. Now,
there's different ways of taking it. We refer to it as dosing. There's all kinds of different ways to be able to actually use the product. I'm going to let you walk through this because you've used most of these dosing formulas. What's your thoughts on this?
Start low and go slow. That's the first piece of advice I give for every potential patient that I speak with. You've got to start low and go slow. So if you are somebody that doesn't necessarily like taking capsules, or you've been taking pills from the VA or your pharmacist for decades and you don't want to take a capsule, maybe look at a sublingual drop or tincture option for you. It goes right underneath the tongue, really quick and as far as efficacy, and 15 to 40 minutes, and it's very effective. It may last between 4 and 6 hours as well. I'm a vape pen guy. I like to have that immediate relief, like I mentioned earlier, in a night terror. When I wake up from a night terror, I, I can't get out of my head. I can't get out of that bad dream that I was in. A vape pen allows me to inhale and exhale, and I'm almost immediately back to where I need to be, which is normal, and it helps me really get well fast. Also, some of our older patients that we work with, they love capsules. They can put it right in their Monday, Tuesday, Wednesday, Thursday, Friday container. Your capsule's in it, boom, just take it as normal. Some people prefer edibles, which they bake into cookies or brownies. A lot of people like topicals. Topicals is where you just put a lotion or a topical gel on top of your skin, or really in a veiny area. So inside of your arm, inside here, inside your thigh, where you've got a really good artery or a vein, because you want it at the top level where it can get directly in your bloodstream. And then the same thing with the transdermal patch there too. Topicals are almost immediately effective, but they don't have a really good staying point. They don't last a long time. Transdermal patches, and it's different for each person too. So you've got all these great things listed: sprays, flowers, crumble, and shatter. If I say anything, don't get discouraged by using something one time and then throwing your hands up saying, oh, it doesn't work for me. You've got to stay with it. You've got to try it multiple times, and you have to start low and go slow. So maybe give yourself a week or 2 weeks to determine whether or not this standard dosing protocol works for you. And if it doesn't, improve it, increase it, or change the way that you're dosing it. So go from a sublingual drop to a capsule or to a vaporizer. So I always recommend, for our brand new, no experience necessary, I like for people to try vaping if they've never done that before. It's the most immediate one. They're going to know within a couple of times if they tried it. Sublingually, you got to stick with it. You got to try it day after day after day for a couple of weeks to determine if it's going to work for you and what your proper dosing protocol will be as well.
Yeah, I think there's two comments I want to make here. Number one is transdermal patches are great because when you put them on, within typically 10 minutes to an hour, they start working. The nice thing about a transdermal patch is if you feel some ill side effects or you're not feeling well, you can take the patch off. And literally within 15 minutes to a half hour, the CBD is out of the cannabis is out of your body, and you return back to what I would call your normal state. But the patch is a good way to help you figure out what your tolerance is, how much you should be taking, and that type of thing. The other thing I wanted to point out was, in my particular case, I'm fighting inflammation and I'm fighting pain from an auto accident. One of the issues that I have is I take the sublingual drops in the morning, but when I get out of bed, my pain level is a 7 or an 8. And so, because I have 7 herniated discs in my neck, I actually do what you do. I grab the vape pen after I do my sublingual drops, and I take a hit out of my vape pen. And literally within a minute or two, the pain reduces down to a level of 1 versus a level of 7 or 8. In other words, I'm using them in combination, or I'm using the vape pens to get me past the pain level of being able to go back to work, and then let it kick in 30 minutes later or 40 minutes later to be able to use both of them.
Yeah, and Mark, I think most patients, when they get into this, they'll find that they probably will use a combination of items. I use a combination of sublingual drops, capsules, and vape pens. So I'm just like you. It's which one do I want to use, and what can I take with me if I've got to be out of the office that day or on the road or whatever. So it's all about your situation, and you're probably going to use a number of different delivery options as well.
I will not overlook, now, unfortunately, edibles are not legal here in Florida, but my mother, who lives in California, is taking medical cannabis to address her cancer. And she's, by the way, been treated, she's been in remission now for 3 years. That's What's awesome. Interesting is her favorite dosing formula is edibles. She grabs actually some brownies in the morning, she has some gummies in the middle of the day. In other words, she's able to put them in her purse because she's in California, and she finds that's the easiest way for her to use the medical cannabis.
Absolutely.
I think once we get it here in Florida, a lot of people will find that that's a pretty good dosing form.
Well, and it's great to have up here too, because a lot of patients are making their own edibles at home too. You can make it with flour and make a butter out of it. So I think it's great to have there and actually talk about it too, Mark. That's
or use a concentrate and just drop it in a brownie mix, one of the two.
absolutely.
That works as well. When you do that, though, be very careful. Don't go out and eat more brownies after you do that.
Start low, go slow, right?
Yeah. We talk about cannabis as a solution. I think there's other things that go with this. I know, especially in the veterans communities, there's a lot of discussions that you have. Why don't you talk about the different other things that augment medical cannabis?
Yeah, and I want everybody to know that, we're not talking about a one size fits all and one pill fixes everything either. This is a completely holistic approach to improving and managing PTS when you have it, whether you've got it from a combat situation or you've got it from a civilian situation, a car accident. Doesn't matter. What you've got to do is you have to do a combination of things to manage that. So talk therapy is a really great option, and the VA does a really good job with it, whether it's getting into group sessions and talking about the issues that you've got, or working directly with a psychologist or excuse me, a therapist, whatever it may be. Animal therapy, as you all know, the working dogs that are there, they're really great to help manage PTS for many, many veterans and many civilians as well. Music therapy is phenomenal. Mark, you and I both love Gary Sinise, and they do some great things with music therapy, lifestyle, dietary changes. Really, it's the whole body approach. It's the holistic approach. So when we're talking about medical cannabis, we're talking about getting back to a plant-based medicine. Well, that can do plant-based diet too. Almost all of our medicines are actually developed from some sort of plant. So if we can get back to improving our health by eating properly, going back to a plant-based diet, eliminating, saturated fats and eliminating all this, nasty stuff, the hormones and the therapies that are in our cows and our pigs and stuff right now, and go back to a natural eating and natural lifestyle, it really helps. It's that mindfulness. It's that happy medium. Meditation is a phenomenal way to do it. They got a lot of apps that are out there that can help people manage through it and walk through meditation practices. Yoga is another great one. My wife is a yoga instructor, and we're really big into that, the Reiki lifestyle. So I don't want to sound like some kind of hoot or craziness like that, but I think everybody understands that our health system in the United States, what it's going to is just throw a pill at it. It's where it's been. My assistants are here with me today too. They just throw a pill at it. And unfortunately, that doesn't work for a lot of people. You got to move back to improving your quality of life from the inside out. And that starts with diet, that starts with exercise, that starts with your mind.
Well, I think that when you get into medical cannabis and you're addressing PTS, what happens is the first thing that happens is you calm down. Mm-hmm. I think that until you calm down, it's very hard for you to look at other things. But when you start calming down, when you start being able to relax a little bit, then the question is, what's the next step? And that's where being able to talk to people, if you're comfortable with that. I've visited a couple of places where they have the veterans and the dogs. It's amazing what it does. They do amazing things. Nice thing I like about music therapy is you can take it with you. Yeah. I mean, you can literally be sitting in a car and working on it. And it's your body, it's your diet. You only have one body. If one person walks away from this webinar and is being helped and their life becomes better and they get their life back, we've accomplished what we wanted to accomplish. And that's really what I'm trying to do. And I think to being able to have the right diets, be able to meditate, be able to care for yourself, I think that's important. So maybe it's a great time to answer some of the questions.
Yeah, I think it's a perfect time. There was one that I saw earlier. I'll read it from an anonymous attendee. While it is great that medical THC is legal in some states, are any companies passing HR regulations to allow for veterans who may be taking THC products? That's a really great question. And there are some companies, they're mainly private companies. In fact, they're all private companies. No public entity like a state or federal government is going to change their stance on THC. But New York just last week was really phenomenal. They came out across the entire state and said nobody can test for THC and not hire somebody because they tested positive for THC. So that was a huge win for us in the medical cannabis community. There are some companies right now that are changing their HR regulations to allow THC for any patient, not just veterans, but for any patient that has THC in their system, as long as they have a medical cannabis prescription or card. So great question, and hopefully that answers it for you.
You know, it's interesting. I grew up in California, and I worked in Silicon Valley for 38 years. I started with Hewlett-Packard. I was part of the Netscape, I was employee 25 at Netscape. I kind of went through the whole gamut while I was out there. And then I moved to Florida for a lot of reasons. One of the bad habits I have is golf. So I came out to play some golf. What's interesting is one person asked me when I first got here about this issue of working in medical cannabis. And I jokingly said, in Silicon Valley, if they tested for cannabis, there wouldn't be any programmers. Google wouldn't exist. Facebook wouldn't exist. HP wouldn't exist. It's one of those things that was, even though before it was legal, it was something that was known to be able to help people relax, help them with their creativity and that type of thing. I think it's important that our legal system catches up with nature and reality. Okay,
that's right.
I think that's important. And unfortunately, we keep bucking it, but I think if we keep at it, we'll get there. It just, we have to go back to the natural way of doing things.
Yeah, I agree. And Mark, there's another question that I think we should just run right into after you just alluded to that. It says, why do we not work for getting legislation for disabled veterans to get an expense for their medical cannabis? Thanks from Angel Pena, I think, GBY. That's a really great question. There's some legislation that's been tossed around out there to help veterans get access to medical cannabis and pay for those recommendations. But we can't do anything until the federal government, the VA itself, changes their stance on what is THC. So we could go into the VA right now and get a recommendation because the doctor only recommended, he's only signing off that, yes, you have PTS, or yes, you have these issues, and that's it. All they're doing is confirming that. We can't even go into the VA and do that now. So we've been working on legislation for 6 years now. I know I personally have, and I've been to DC and spoke with senators and representatives, but just keep in mind that the number one lobbyist in the United States is the pharmaceutical industry. And the number two cost, outside of direct cost of care to veterans, is pharmaceutical cost to the VA. So it's hard to get things done when we're not paying $25,000 to sit down and meet with a senator or representative from our state
yeah, it's political. It's purely political, and that's why we have to keep up the pressure to our politicians to have them understand, go the way of a natural remedy. Let's grab another question. One of them was, how many strains and are some that cause increased paranoia beyond personal research? Are there any recommended cannabinoid profiles for PTSD at all?
Yeah, so there are, and like we mentioned earlier, it's all about you. We can say, yes, I wish it was a one size fits all, but unfortunately it's not. So I think a high dose of CBD is a starting point for many people who are suffering from PTS. So that's a great point. A lower amount of THC, because you want to have a little bit in there, but you don't want to have too much that you could have a bad time too, because it can exacerbate some issues that come up. So it really, in CBG and CBN, there's a lot of different combinations that are out there, but really look at the cannabinoid profile and the terpene profile. Try to stick with myrcene, linalool, the terpenes that try to calm you down if you have anxiety levels, or look at some if you're lethargic and tired all the time, maybe look at one that gets you alert. So good question, and I wish there was a one size fits all, but there's not.
Well, and there was one question that came up that said, is there a short list of strains? And we gave three, the limonene, the linol, and the myrcene. They're asking which dispensaries carry them all. All the dispensaries have them. It's a matter of just, again, when you go in with your recommendation, talk to the bud tender, the person behind the counter, and they'll be able to walk you through the different options that are out there and steer you away from the ones that may be a problem. You have no problem talking to them about that. One of the other questions that came up is the high risk of vaping or using concentrates. There was a whole vaping pen scare where people were dying from bad actors and bad products.
Right.
It had to do with products that were not tested and not certified, and people were dying, and they came in. They were just bad products. One of the problems we have here in the United States is they don't test the CBD products. Now, that being said, Florida deserved a lot. The Florida state of Florida has done a wonderful job. Any product that you buy, whether it's CBD or it's a medical cannabis, on the side of the bottle will be a QR code. And if you take your smartphone and put it up there, what it'll do is it'll then show you the report, the certification for that particular product and the testing that's been done on it. So you know it's safe if you use it. Nikki Fried brought forward a bill, and now as of January 1st, that has to be on every CBD product. So you used to be able to go to a gas station, buy a $30 bottle of CBD, and you hope like hell it worked. God knows what was in it, and you were taking a risk. Now they cannot sell that product, and the state is actually weeding out all those bad products. And like I said, go put your cell phone on there and see what's in there. I think it's very important. The testing has been done here in the state of Florida. Just take advantage of it. I think that's very important. Now, if you're going to go, I know when I go out to California and visit with my mother and my friends, there's a lot of dispensaries out there. God knows what's in there. And I don't touch a product that doesn't have a QR code on the side. I'm just telling you right now. I don't care what the people say. My life is too important. And there's been so much testing done, it's time to be able to leverage that. Nancy brought up a question that she got a medical cannabis card, and it's been a frustrating road. And I'm going to tell you, a lot of new patients who get into medical cannabis have that problem. They're kind of stuck into a world where they try different products, they try different strains, which is what you're saying that you're doing. Here's what happens. You're given a recommendation, and it's important that you work with your doctor and you work with your dispensary to really dial in the product that you want. Unfortunately, here in Florida, a lot of doctors will give you a card. They thank you very much, and adios. If you want to talk to them again, they charge you, or if you can even reach them at all. And I think that's one of the problems here in Florida, is being able to find a series of doctors that can help you. One of the reasons I work with the medical marijuana treatment clinics, and yes, I am throwing a shameless plug to them, is they have a dosing center. And if you're a medical marijuana patient, if you're a patient or you got your card from an MMTC doctor, you can actually call their call center. They'll put you in touch with the practitioner or the doctor himself. They'll actually help you be able to figure out what strains, what products. They'll actually get on the phone with the dispensary and help you be able to figure out what works for you. So I would say that if you have a card, talk to your doctor. If it's hard to talk to your doctor, transfer it over to MMTC. Again, if you're going low and going slow, as you're ratcheting up, it's good to have somebody work with you to be able to help you be able to go through that process and get it right. It took me about 3 months to really get it right. But now that I have it right, my life is so much better. I'm glad I went through it. Now, why did it take 3 months? Because I'm a stubborn guy. Okay, I didn't ask for help. Okay, and I didn't necessarily ask my doctor. I knew better. But when I started talking to my doctor and working with it, it's amazing how life works. So, Nancy, I think the best thing to do is I'd get a hold of MMTC. Not necessarily you have to transfer over, but they'll explain to you what the dosing center does and how it works. Getting into cannabis without help of a doctor is, you might as well not even get into it, because it's going to be that complicated for you. You're heading off, you have a boat setting off into an ocean, and you don't have a compass. Get yourself someone who can help you.
And Mark, I wanted to kind of tune in on that one a little bit too, because we had two questions that were almost the exact same one from Victoria and Nancy on those two, about going to sleep, not a problem, but staying asleep is the issue. I'll tell you all that in my personal experience, I've seen that if I'll take a higher CBD product and a higher dose of CBD product with some THC in it right before I go to bed, I can typically sleep for a good 4 to 6 hours, 6 to 7 hours sometimes too. So just take a high dose CBD, mid dose THC right before you go to sleep. And then when you fall asleep, you should stay asleep longer with that as well. So something to try out there.
Yeah, it's very, very, it's something that, again, work with people. Go to people who know what they're doing. Talk to cannabis practitioners. I know I spent 2 years studying and then another year actually testing to become a practitioner. And there's a lot of information that can be brought to the table to help patients be able to cut down the experimental time. Let me put it to you that way. I think there's also someone, I think no one was asking about what's cheaper. I think everybody has to be very careful about cost, especially today in this environment. I think that there's a perception that flower is the cheapest that's out there. I find, in my opinion, I find the tinctures and the vape pens to be the most cost-effective way to do that. In other words, I have a bottle of tincture oil that I buy, and it lasts for a month, almost 6 weeks. Where in other forms, like the capsules and things like that, I burn through them in 2 to 3 weeks, because the capsules go into your stomach. About a third of the product is absorbed by your stomach, so only 2/3 of the product is getting into your bloodstream and helping you. When you tincture oils, you put it under your tongue, 100% of the tincture oil goes right into your bloodstream and helps you. So you need less of it, first of all, and tincture oils are typically cheaper to produce. So that might help you a little bit there. But there are people that don't like sublinguals. There's some people that have trouble vaping, and that's understandable. But I think the most cost-effective that I've seen right now are tincture oils. On the issue of the government being able to come in and help you with your medical costs, they should. And there's a number of and I'm not trying to be political, I know there's a number of politicians, this is an election year, pay attention to the position that the person you're voting for is taking on the subject of medical cannabis. Okay, there's a lot of people who talk about it, but there's very few people who are willing to do something about it. A couple of candidates.
And Mark, that's a great point, though. It is an election year, and you have to ask these questions of the people that we're going to put in office. Look, I'll tell you all right now, the Florida program is friggin' broken. That you got to go to the doctor every 6 or 7 months and go back and get another recommendation. You haven't changed. They had to certify that you've had these issues for 6 months plus when you signed up. So this is crazy that we have to go back to the doctor. We got to vote people into office that are going to be on the patient side, not on the pocketbook side.
Yeah, I think that one of the things that and again, I'm not being political, but I am being that politicians work for us. We don't work for them.
Correct.
They get voted in because of us. And I think we don't understand. I think a lot of people have you kind of look at a politician as if they're above us. They're not. They work for us. I have one politician that asked me for my recommendation, and I basically said, I won't recommend you because you do not support my platform. You do not support medical cannabis. You don't support helping the people and helping people get back on their feet. And I think it's important that you do that. We have to build a society that's good for the people of this country, because when the people are taken care of, everything else flows. And I say that because it's important that we are able to get the medications, to get the solutions to help us get our life back.
Yeah, and Mark, there's a question out there. I think it's a great one to bring up. Let me pull this. It's from an anonymous poster. I have PTSD linked to childhood sexual abuse that causes me to disassociate. What is a strain that can help me be in the moment and not overwhelmed and paranoid? And that's a really great question. And what I tell people that have asked me, what is something that I can utilize and not get zonked out? Well, one of the great things to look at is the terpene profile. So we go back to that terpene profile earlier that said couch lock, really, heady, all that good stuff. We want to stay away from those kind of terpenes. THC, CBD, probably do an even ratio on those, but try to get something that has a little bit more alertness to it to help you be more in the moment and more active with conversation and maybe engaged. You don't want something that's going to completely zonk you out. You don't want a 95% THC product that's going to have you completely zonked and not know what's going on and cause even more disassociation. So maybe a 1-to-1 ratio on CBD to THC.
Right. A few people have asked, how do I get a hold of MMTC? You're going to get an email follow-up to this that will give you links. It's mmtcfl.com. Please go look them up. I highly recommend them. Now, one of the questions that Sarah brought up, and it's a legitimate question, is she says that they're astronomical price and they're increasing. Well, I know they're not increasing because I've worked with them now for 4 years and they haven't increased their prices in 4 years. There's a couple of things that are important. First of all, quality doctors like MMTC, the state of Florida requires them for every patient to send in 600 to 800 pages of documentation in order for you to get your card. This was something that Rick Scott put in place to try to slow down the use of medical cannabis and to try to price it so that it would be hard for people to use. He did such a great job of that. We have 400,000 patients today because people still are in pain and they need help. And all they did was just increase the cost for nothing. And I do think that if we can get the paperwork down, you can get the cost of it down. If you have a doctor that's not doing the paperwork and not following up, like a lot of doctors will say, come in, see me, $99, I'll get you your card, then you can't find them in 6 months, they're not helping with the dosing. The other reason that MMTC is a little bit more expensive is because the call center is part of it. You don't pay extra for call centers. A lot of doctors will charge you nickel and dime you. They'll get you a card for $125. Want a prescription? Oh, that's another $100. You know, you need a question answered? That's another $100. By the time you're done, you're out $1,200. So I'm saying that that cost is an all-inclusive cost, and unfortunately they can't control that. They have to be able to recommend that. Now, medical marijuana doctors in Florida are not going to do a normal exam like you're used to seeing when you go to a doctor for, let's say, an elbow or back or something like that. They are there to only do one thing. They're there to verify that you have a condition that meets the state qualification. That's what the state recommends. In many cases, a lot of doctors never studied cannabis when they were in school. They're new to cannabis. I have a lot of, when I first got in this business, I had a doctor that I was working with for a back pain. And we had raging discussions about, he said, well, you're not a doctor. But I knew more about cannabis than he did. I knew more about pain than he did. It wasn't a matter of degree. It was a matter of how much did you know about this particular subject. The people that work in these clinics are practitioners who've studied more and know more about medical cannabis than most of the doctors that are there. The doctors, however, have to verify that your condition meets the state recommendations. And the other thing the doctor does, Florida did something that was right. What Florida did was Florida said that if you have a condition that is like one of the state recommended conditions, you qualify for a card. And what that means is, rather than they have I think 14 conditions now, rather than trying to produce a list with 300,000 conditions, they let the doctor make that recommendation. So it's not a matter of how much time you spend with them. The doctor will look at this and say, for example, you have degenerative disc disease. That's very similar to MS, therefore you qualify for a card. And by the way, if you go to a doctor and you don't qualify, you don't pay for the appointment. Okay, so there's no harm, no foul in that particular area. But I think it is important that you get somebody quality behind you to be able to help you out. Going cheap, buying a $100 product and not being able to talk to the doctor, it may work, but the chances are very slim. You need help. And I can't emphasize enough the contribution that the quality that the call center makes. And I think one of the things Sarah also pointed out was the doctor spent like 5 minutes with you. The practitioners do most of the work. We know pretty much what to use, how to use it, that type of thing. The doctor has his role, which is signing off and put the people that are there. The practitioners do a lot as to what kind of recommendations should be made and that type of thing. It's the same thing when you go to a normal doctor, you see a practitioner and then he signs off at the end. I know when my medical doctor does the same thing. So it's really a matter of being able to use the expertise. They're working in teams and they're working in unions. One of the things I find amazing is the lady who put together this webinar, the lady who put together the material for this webinar, Alyssa, is phenomenal. And she is probably one of the people that I would say knows more about medical cannabis than anybody that's out there. She's not a medical doctor. She is a practitioner. But Alyssa is someone who I think is somebody that I would listen to because I've seen her background, I've seen her work, I've seen what she does, and she knows how to cut to the chase. It's something that's important. Anyway, it's something to take a look at.
Marc, I want to address Roz's question real quick. He says, you've mentioned high dose of THC or low dose. What is a low dose for CBD? And he also has a second follow-up question. What is a high dose of CBD? What is a high dose of THC? When I'm talking about dosing, I'm actually talking about milligrams per milliliter or milligrams per dose that you're taking. So a normal dose of CBD would be somewhere around 20 milligrams to 30 milligrams of CBD per dose. A very small amount of THC, just a normal starting amount of THC is about 5 milligrams. So when we talk about low dose or high dose, on CBD, you can take 1,000 milligrams. It's not going to hurt you. It doesn't cause any psychoactive effect. And your body just excretes it through the urine system. When you've taken too much of it, it just processes it and spits it out. Well, THC is a little different. So when we talk about high dose of THC, anything over 5 milligrams, you want to be real careful with and do it slowly, like we talked about earlier, So when you're taking something of maybe 20, 25 milligrams of THC, that's a very high dose and can have catastrophic psychological effects, meaning that you can have a freak out, if you will, if you have too much THC. On CBD, you're not going to have a freak out. That's the great thing about it. And CBD can actually help you come down from that freak out on THC when you sometimes have consumed too much THC. So 5 milligrams is about a normal dose, and a high dose would be 25 to 50 milligrams of THC.
Yeah. And by the way, what does that mean? If you take an eyedropper, the bottom quarter is 25 milliliters, halfway is 50, 3/4 is 75, 75 is 3/4, and the whole thing is usually, again, 100. So those are kind of.
I think it's a good point to show people.
Oh yeah, there you go, perfect. Yeah.
You actually want to have a dropper that has it listed on the side of it. You want to know that what you're taking, you can accurately dose each time too. So that's a big thing. You want to make sure that you're buying from somebody that has the dosing inside the bottle each time so you can dose it.
Yeah. And I think that one of the questions that came up, somebody asked me about the MMTC thing is, where do I live and what's a normal cost? I live in the Orlando area. I live in Claremont. The cost for MMTC is the same all over the state. The cost is not driven by the area that I live in. The cost is driven by the fact that the state requires paperwork, and then you also have to have a call center that's available. And I would say typically what happens is it costs every 6 months, costs you approximately $200 every 6 months to be able to get that doctor's recommendation. Now, the state of Florida dictates that. State of Florida requires that you go in and get your recommendation. Then after 6 months, you have to go get another recommendation. The reason that they did that was so that they made sure that your doctor was following up on the dosing for you. In other words, it kind of forced the doctors to get involved in the party. Unfortunately, Rick Scott took that and then used that to try to use it against you. One of the things that I recommend to get the cost down is not necessarily beating up MMTC, because believe me, they would love to drop that cost down and get rid of their paperwork. That's a whole cost engine they would love to get rid of. It's a headache. Let's put it that way. Work with your politicians and have them get rid of all the back end stuff that's not needed for your medical cannabis recommendation.
We've answered just about all the questions that I'm seeing on here too now, Mark. There's one about, what's the best strain for pain and inflammation, the best dispensary to check out. Look, we're not here to recommend dispensaries or anything to anybody, but the real key is just learning who you are, what your body is. And I know it costs money to take time, but if you're talking about finding out what's going to work best for you, try different dispensaries. I've been to every single one of them. Every one that opens up, I try to go in, say hello, introduce myself, get to know those people, and find out what their products are and see if maybe they have a product that I like better. So it just takes time.
Yeah. I know, Sarah, you brought up a question that MMTC doesn't communicate whatsoever with the dispensaries. I'm sorry, I'm going to call you on that. I have been in a dispensary where I had a question about my recommendation with them, and we literally picked up the phone and called MMTC, and they got on the phone and answered it. And that's happened for myself. It's happened with my wife 3 times. They are there to be on the phone. And in fact, one of the dispensaries didn't know this existed and was favoring another doctor, and turned around and looked at me and said, candidly, if I'd have known that, it would solve a lot of my headaches of trying to be able to work with patients. All I can say is try the call center. It works, and it's helped a lot of people. There's one other question that came up about using medical marijuana and a lot of losing their job because of COVID-19, which there's about 40 million of us in the United States that have that situation. And so the question is you're talking about not only just a place to test with THC. All the dispensaries test their products. I visited most of them. I've gone to their grow facilities, and I can tell you they do extensive testing and they take it seriously. You go into these grow facilities, it's like going into a NASA place that's building a rocket ship. You got the hats on, you got the shirts on. I mean, it's a clean room. They really are conscious about making sure they put out a quality product. Now, as far as MMTC recommending a good cleansing product, I don't know if MMTC is the best place to go to because they're medical cannabis folks. But I would say find yourself a good holistic practitioner, and if you need to find one, send me an email, and I'll give you a list of some practitioners that can help you with, from a holistic standpoint, with some products in those particular areas. So are there any other products that we haven't, any questions we haven't answered?
I don't think so. We had one that was a very specific question from a patient. It was an anonymous one. And what I just want to address that one, 28-year-old male, ADHD, night terrors, paranoid, depression. So we're not doctors, Mark and I. So what we recommend is finding a physician to go in and talk to about your specific issues, and, you know, helping them understand who you are, and then they can help you find what's going to work better for you or best for you.
Yeah, I think this is where the doctor, the dispensary, and yourself can work together. And again, the recommendations, I'm going to leave it to the professionals. The person at the dispensary will know the right products. The doctor will be able to make the right recommendations. And then I think the other is every person's body is different. And that's what's important. It isn't like a matter of just taking a pill and it solves the problem. I have my body, I have a high tolerance for THC. And so I need to take a little bit more of it to address the neck pain that I have. My wife, however, has a very low tolerance for THC. She got a product one time that was one CBD to 4 THC, and she was stoned. Best way of putting it. So we have her in 12 to 1 and 20 to 1 category because she's just different than me. It's not that she's good or bad. Just every body is different, and so I think that's important to be able to. You have to tune it for yourself. This isn't like taking, one aspirin and it'll go help you. This is where it really makes a big difference to what works for you, what type of product works for you. Let's put it that way.
I carry one last question there, Mark. Do veterans have to go to a private doctor for their RX, their medical cannabis prescription? That is correct. We do. We cannot utilize the VA system. They won't make recommendations for veterans. They have to go seek outside care and try to get a recommendation from a physician that they don't see normally. So it's really frustrating. We're trying to get that changed at the federal level. But great question. I thought I would address that before it's over with too.
Yeah. And by the way, Catherine was asking about bug bites and cannabis. I haven't seen any products in that particular area. I know that bugs don't like me. I mean, I can walk outside and mosquitoes run around me. They love my wife. They love my wife and my grandson. I jokingly call them the mosquito chasers. I mean, they're there. I would love to say there is. I don't know of any. I know there are great medicine, or there are great topicals for that, but the cannabis isn't going to be the answer for that. And I think also it's important to point out there's been some articles coming out lately about cannabis being used or studied with COVID-19. There's no evidence that medical cannabis helps with COVID-19. It helps with the anxiety. It helps with the stress, but COVID-19 itself, there isn't any evidence of that. I deal a lot with doctors in Israel, and there's some studies being done there, but they're very early on. This thing is deadly. It will kill you. Okay, I've got one friend of mine who was absolutely thought it was a hoax, thought it was just a game. He lived in the Atlanta area. He was just absolutely, Mark, you're crazy to follow this. I sent flowers to his funeral about 7 weeks ago.
Oh, man.
Okay, I mean, it is not a game. This is your life. We've addressed pandemics as a country in the past, and we did it through science. We did it through good, logical reasons, and we did it by helping people. So,
Mark, there's one last question from Sarah I want to go ahead and address. I think it's a great question for everybody here. Do you build up a tolerance? And you do. You do actually build up a tolerance. A great way to reset your tolerance is just to take a day or two off. So if you're taking a high dose of THC every day, maybe take 2-3 days and titrate down off of it. So go from 75 milligrams to 50 milligrams to 25 milligrams. And as you do that, increase your CBD consumption during those 3 days. Take it off, level off, and then you can go back to normal practices. The great thing about it is we don't build up a normal tolerance like pharmaceutical tolerance, but a mental tolerance can be built up to cannabis that can be reset pretty quickly. So
yeah, and in my particular case, because I have a high pain level, like I say, I have a level of pain 7 or 8. The herniated discs are so bad in my neck. I've gone to doctors, and the doctors looked at me and said, "We can't operate. It's too dangerous." Because of my pain level, I actually will stop taking it for about a day to a day and a half. Just go cold turkey. And that's because after about a day and a half, I don't need cannabis. I'm not addicted to the cannabis. What I'm addicted to is getting rid of my pain.
That's right.
After about a day and a half, my neck taps me on the shoulder and says, "Cowboy, if you don't get back on it, we're going to let you know we're here." And that's kind of what's going on. So that's what I found is the best way of doing it. And I think your recommendation is slowly go down and go back up. And I do know that when I go off it for a day and a half, and then when I get back on it, it's much more, just put it this way, my body reacts. What my body is doing is my body is getting lazy. My body produces endocannabinoids, and when it's getting it from the outside, I'm an older guy, so my body says, hey, let me just relax. Let me sit on the couch. The train's going to show up with the medication that's needed. Why do I have to go to work? It's on holiday. And when that train doesn't show up and they have to go back to work, it does wake up and it does really help you in that particular area.
Right.
So anyway, I think we've answered most of the questions. I know one last one came in from Cree about does sativa truly help improve mood? I would say what improves your mood more than sativa is the terpenes. Okay, I think there was a time when people did use sativa and indica. One would make you calm, one would get you excited. That's all gone out the door the last 5 years. Check the terpene profile. And when you want to chill out, check the right terpene profile and you go from there. I have a product that I take when I knock off for the day. And at the end of the day, I sit on the couch with my wife to watch TV. I have a product that I take that just helps me chill out and helps me go to sleep in the evenings. And if I don't do that, I will wake up in the middle of the night and go take it because my body just needs to chill out. It's from a pain. It's a pain issue. It's not anything else. I want to thank everybody for your time. I want to thank you for coming in here and asking questions. You will get a follow-up email to this that'll give you a lot of resources to be able to help you out and also to be able to reference. And of course, if you want to send some emails, the events at marijuanaaware.com, you can send those to me and I'll be more than happy to answer those. So Joshua, thank you very much. As always, you did a great job. And I want to thank Lee and Deja for helping with the questions and the answers.
Thank you all.